Bonjour, Christina.
Bonjour. Thank you so much for having me, Isabel.
You're welcome. So, one of the best ways to learn more about the field of pharmacy, I say to myself, is to speak to a pharmacist about your professional experience. So, I'm going to introduce you to our reader. So, you are the founder, director, and CEO at the Public Health Pharmacist that you founded this year, last May.
Yes. I actually started my social media presence and my personal branding for the Public Health Pharmacist back in November of last year, but I officially launched my consulting business in May, which was literally in the middle of the pandemic. So pharmacists in the United States are very versatile and have multiple specialties and discipline. And I, in particular, specialize in public health, meaning the health of the many versus the health of the one, and something called communicable infectious diseases, meaning infections that can spread to others very easily. So I promote things like vaccinations. I talk a lot about sexual health and people making sure that they're tested so that we can decrease people's risks of acquiring things like HIV. I also have been called upon in the media a lot lately to talk about COVID-19 because of our current pandemic. So my now almost 14 years working in public health, either directly with our local health department or through my clinical experience with the family medicine practice that I work with right now, I have seen many different changes within our healthcare system. And obviously here in the United States, things are they've become a little bit more challenging. So I feel very fortunate that I've been asked and called upon by some of our local television news stations to comment on the latest and greatest related to COVID-19 and how people can protect themselves during this pandemic, as well as how they can travel safely.
But what made you go into the field of pharmacy?
So that's a great question. When I was studying in college, I was what they call pre-medical. So I was doing biology with the chemistry minor, and I was looking at all the different graduate programs I could go into. Obviously, I could have gone to medical school, I could have gone to graduate school, I could have gone to dentistry, optometry, pharmacy. There were lots of different options, but at the time there was a new pharmacy school that was opening here in the Las Vegas area, and I wanted to stay close to family, so I applied, and I was accepted right away. And so it kind of made my decision easy at that point, because it was something in the medical profession, something that I had an interest in, but also allowed for me to stay close to family.
And what is your consulting business journey like during a pandemic?
Yeah, so excellent question. I would say that the big thing for me is that I really I wanted to give more exposure and more light to why pharmacists should be called upon more as it relates to public health and public health interventions. And so that was really the start of it, and really wanting to promote pharmacists working in public health and how they can really make a meaningful impact in their communities to make them healthier and happier. And so with that being said, the consulting business initially was started in order to do more public speaking and professional speaking and keynotes, talking about public health and why it's important and why we want healthier and happier communities, to do more preventative medicine versus treating illnesses after they occur. And then it kind of evolved into this, being able to help businesses navigate coming back from being under quarantine with the pandemic, also doing consulting, helping people be able to do vaccinations safely in their clinics and in their pharmacies, and then just really all things related to public health and preparedness as it relates to the pandemic. Also, doing things like commercials. Like I would never have thought, if you had asked me 9 months ago, that I would be in a commercial for a mask company. But given my exposure and all of the the media coverage that I've gotten, it was a good fit. And the company, it's called Boomer Naturals. They approached me about a partnership, and I believed in the product, and I was like, of course, sign me up, let's do this. And so my journey as a television personality / media or healthcare media contributor really came out of me wanting to give more of a light and exposure to pharmacists and how unique we are, and how we're kind of an unsung and untapped resource within the healthcare system. And luckily I also love fashion and beauty, and so it was really a great fit. And so I would say it's definitely not something I anticipated, but it is something that I enjoy and love, and feel very grateful that I've had all of these opportunities to be in the media and to be more prominent as a promoter and a lover of the field of pharmacy and what the profession of pharmacy is really capable of.
And weekly, you also have a podcast.
I do.
Right. So how can we find you?
Absolutely. So there are lots of different ways that you can find me. I have a YouTube channel. I have a podcast. You can find me on Instagram, Facebook, and Twitter. And it's all at the Public Health Pharmacist. And my podcast is called the Public Health Pharmacist Podcast. So that's where you can find me, and I'm super excited to bring new and very, what I would consider, impactful guests to come on and discuss how this pandemic has affected them personally, professionally, and how we can really incorporate those public health interventions into our lives, and how we can prevent illnesses so that we can all live happier and healthier.
What has been the biggest thing that you think people do not understand or have misunderstood about social distancing?
So that's a great question. So with social distancing, I think, first and foremost, I think there are a lot of people who are experiencing something that we call quarantine fatigue, or just pandemic fatigue in general. I think in the beginning of the pandemic, we thought that this would be somewhat temporary, and the fact that we're still 9 months in, and we're needing to wear masks in public and needing to stay at least 6 feet apart from one another, I think that people they're getting tired because they want to go back to the lives they had prior to when we discovered the virus. Unfortunately, for us to be able to go out in public and enjoy things like being around others and gathering in public, social distancing is really the thing that we're going to have to do until we have a reliable treatment, or when we have a vaccine available, so that everyone is either immune or has recovered from the illness. And we do that by keeping a distance from each other in order to, what I like to say, keep our respiratory droplets to ourselves, because we don't want those who are asymptomatic, meaning they have no symptoms, spreading this infection to others. So that's really what we're trying to do when we're asking people to distance. It's not that we're trying to purposefully keep people apart, because obviously we know we need human connection. It's more because we're trying to help the safety and wellness of all of us, and making sure that we're taking into consideration that people may have someone at home that's at high risk that they don't want to infect.
There is a lot of fear about coronavirus living on the surfaces. How can we stay healthy while going out and interacting with others and, try to feel less. So it's not for everybody, obviously, but could you tell us your insights?
Yeah, so if you're otherwise healthy or well, you can go out in public safely. The one thing that we would recommend is that if you are going out in public, outdoor spaces are better than indoor. Making sure that you are distanced from others, especially if they're not part of your family unit or someone that lives in your home or isn't in your direct circle that you're around often. And then as far as cleaning surfaces, most of the areas in public have disinfecting protocols, so they go and they wipe down things very frequently. For you individually, what you can do is to use things like hand sanitizers if you don't have access to soap and water, and just frequently washing your hands will really help with making sure that if you did touch a surface that you don't somehow infect yourself. I will say that the chances of you getting this infection from touching, surfaces is much lower than you just being exposed to someone else. So how we see a majority of people becoming infected is from what we call person-to-person contact. And so that's you with another person without a mask, not socially distanced. So that's how you would typically get this. Also, there is new information saying that the virus could be in the air or aerosolized, which is also why we say that outdoor spaces are better than indoor spaces. Because if you don't have good air ventilation, there could be some virus still circulating in the air that you could potentially be exposed to.
So what we learned from this pandemic is really, we are getting to be more health conscious, cleaning surfaces, more aware of our health.
Yeah, absolutely. The one thing that I will say that is sort of the saving grace or the silver lining from this is that I think more people will be washing their hands.
Yes.
I think more people will be engaging in more cleanly activities, which ultimately isn't just going to help for things like COVID-19, but also for other infections that are spread through respiratory droplets like influenza or the common cold. So I think overall we may see a reduction in some of those illnesses because of the fact that we've employed some of these safety precautions due to the pandemic. So that might be the silver lining in all of this, is that hopefully some of these precautions will maintain and will potentially help us to decrease other infections in the future.
Hopefully.
Fingers crossed.
Where are we in developing a vaccine?
So that's an excellent question. As far as vaccine development, we have multiple candidates that are currently in clinical trials. Right now, there are 3 candidates that seem to be the closest to getting what we call emergency use authorization or approval from our Food and Drug Administration, which is who approves medications, drugs, and vaccinations in the United States. And with that approval, we would potentially see, at least by the end of this calendar year, if not the early part of 2021, we should start seeing vaccine available for high-risk people, and then most likely it will be available for the general population if they want to receive the vaccination, hopefully late spring, early summer of next year or 2021. So we are actually getting very close to having a vaccine available. So we should be seeing those trials and that data from those clinical trials of those 3 candidates coming out quite soon.
Why are some people not recovering from the COVID?
So that's an excellent question. I think that when we look at this particular infection, it does seem to impact some individuals differently than others. We're still looking at why that might be, whether that's some underlying medical conditions, or maybe there's some genetic factors that this virus may impact some people more negatively than others. There's this concept now that we're seeing that we call individuals who have technically recovered from the infection but are still having long-term side effects. Those are people who we've been calling the long haulers. And so those individuals, unfortunately, are still having challenges with things like fatigue, something called brain fog, where they still feel like they're not able to think clearly. They still maybe have a lingering cough, and just really are not back to where they were prior to having the infection. We're not exactly sure why that is, but there are some people that despite all of our medical interventions and being, mindful of them and their recovery, they're still having challenges. So, those people may be experiencing something called post-viral syndrome, which we've seen with other infections in the past. It's just unfortunate that we're not exactly sure who may get infected with it that may end up with that syndrome. And so ultimately our goal is to prevent people from becoming infected so that we don't have those issues down the line.
How do I get tested? How people can get tested?
Yes.
And how long do tests take to come back?
Yeah, so when we test for COVID-19, there's actually a few different tests that you can use. So there's something called an antigen test, which is typically a screening test. So when you have that screening test, that gives you basically a preliminary diagnosis. If that test were to come back positive, then we would want to do something called a PCR test. That test is the one that you've probably heard about and seen where they, shove that cotton ball all the way
Yes.
up your nose. It looks very uncomfortable. So that would actually be a confirmatory test. So those are the first two. And then we have something called an antibody test, which would tell you whether or not you had the infection in the past. So the antigen test, which is the first test that I talked about, which is a screening tool, can be used on someone who's symptomatic or asymptomatic, meaning that they don't feel sick or unwell. That usually takes about 5 to 10 minutes. So it's a pretty quick test. It's a rapid test. And there's a couple of different manufacturers for that. And then the PCR test, it just depends on where you get that test from, whether or not the facility where you're tested has an in-house lab or if they have to send your sample out somewhere else. If they have to send your sample somewhere else, it may take several days. If they have an in-house lab, it usually takes anywhere from 24 to 48 hours, which is pretty quick. And the antibody test, that's just a blood test. And that test typically is pretty quick to come back as well, especially if you're using a commercial lab. So anywhere from 48 to 72 hours to get those results.
It might be necessary to talk now about the actual travel restriction to Americans to Europe and other places in the world. And vice versa, the Europeans and international tourists waiting to travel again to the United States. Is it safe to travel?
So I would say before you go anywhere, you should check a few things. So when we look at indicators of the pandemic and how to determine if the place that you're going, if they're in the middle of an outbreak, if they have what's called community spread, there's a couple of different factors you can look at. One is the number of cases that they have currently being identified in that area. The other is something called the percent positive rate, which basically tells you of the people who've been tested, what percentage of those tests are coming back positive. So WHO recommends that percent positive rate be 5% or less. So if you check, you can check and see what the percent positive rate is where you decide to travel. And then there's also something called the R naught, or the replication rate. And that R value tells you how quickly people are being infected in that area. So those are kind of the three different objective findings that you can use to determine whether or not the area that you want to travel to is safe. And this would be for both the United States or abroad. And as far as the travel restrictions, you can check those on the Centers for Disease Control and Prevention website. And as far as you actually getting on a plane, I would say that with the proper precautions, you can travel safely. So making sure that you're wearing a face covering as well as some form of eye protection, whether that's goggles or a face shield. But you can travel safely.
And we are all looking forward to go and jump in on the plane again.
I miss it so much.
Thank you so much, Christina. Our interview is ending right now. It was a pleasure to have you today, and thank you for the valuable information you gave to our readers. Anything you want to add?
I would just say stay safe, be well, wear a mask, and always wash your hands.
Thank you.